Leading Causes of Death Amongst Native Hawaiians and Pacific Islanders by Matt, Kevin, Manognia, and Heidi. Native Hawaiians and Pacific Islanders, NHPI, face significant health disparities rooted in historical factors. The objective of this paper is to investigate leading mortality causes in NHPI populations disaggregated from Asian Americans.
To collect information about race groups, we use the National Vital Statistics System, or NVSS, to access death certificate race data from 2018 to 2022 for all Native Hawaiians and/or Pacific Islanders, which, to be specific, includes those of single listed as well as those Native Hawaiians or Pacific Islanders with any ethnic admixture. We're also comparing against non-Hispanic whites as well as Asians. We also collected information on sex and residence, mainly looking at those that live in Hawaii and those that live on the continent. Using the American Community Survey, which estimates total US population counts in the US, we use crude mortality rates and intend to include age-adjusted rates.
Moving on to the results section, for NHPI groups, the leading causes of mortality are heart disease, cancers, COVID-19, external causes, and cerebrovascular diseases. When compared to the leading causes of death for aggregated Asian Americans and non-Hispanic white, we find that COVID-19 ranked third for both NHPI and Asian Americans, but has a higher percentage of total mortality among NHPI. For non-Hispanic white, it ranks lower, indicating a greater relative impact on NHPI and Asian American communities during the pandemic. Another example would be cerebrovascular diseases, which rank fifth for both NHPI and Asian Americans, with a high percentage among AA. For non-Hispanic white, it's less prevalent, ranking 7th.
Looking at Figure 2A for heart diseases, for NHPI males, the heart disease rate of 25.0% is comparable to the rate for non-Hispanic white males at 24.3% and higher than that of Asian American males at 23.7%. This indicates that heart disease is a major health concern for NHPI males, similar to non-Hispanic white males, but higher than for Asian American males. Looking at Figure 2B for cancers, NHPI females have a cancer mortality rate of 22.9%, which is notably higher than the rate for NHPI males at 15.9%. This indicates that cancer is a more significant cause of death for NHPI females compared to their male counterparts. For NHPI males, the cancer mortality rate of 15.9% is lower than that of Asian American males at 22.5% and NHW males at 19.9%. This suggests that NHPI males experience a lower cancer mortality rate compared to Asian Americans and non-Hispanic white males.
For next steps, we'll refit all findings using age-adjusted mortality rate to ensure consistency and comparability across the data. We'll also expand the year range of data to provide more stable estimate for periods preceding the COVID-19 pandemic. Thank you for listening.